when a patient comes in, you get their database information, their name, date of birth. Obviously, you can know their sex, height, weight. If they play a sport, you want to know. Sometimes ask what position they play, because a position can make a big part in what kind of injuries they have. Ask them what allergies they have and any current medications they're on, and then go ahead and ask them what their chief complaint is. You want to ask them if they have any family history, or if they've ever done this injury before, or if they've ever had the same injury contralaterally, or if they've had any injury on either elbow. Then you want to focus on the current injury, how they did it, what they were doing when they did it, how long it's been hurting. Then you want to ask about pain. You can just ask them to describe on a scale of 1 to 10 how much it hurts, and 1 being a hair pulled out and 10 chopping your arm off. You want to ask them if there's any tingling or radiating pain or burning sensation down the arm. Is it getting worse or better? Does it hurt in certain positions, or is it hurt during movement? What they've been doing to make it better, what makes it worse. If they can pinpoint a specific spot that hurts more than anywhere else. Is there any pain anywhere other than the direct injury? And did they hear a popping sound when the injury occurred? Then when you start your observation, you want to look if there's favoritism, guarding, compensation, obvious deformity, discoloration, bruising, swelling, effusion, edema. Is there lack of use? Or ask them what activities of daily living they've changed due to an injury, and is there any scars or bleeding. For palpation, you want to just check to make sure skin color looks normal. Is skin temperature normal? Do the bony landmarks feel appropriate around the area? So you want to start all the way up here in the glenohumeral joint, the humerus, the lateral epicondyle, and the medial epicondyle. You want to palpate the entire radius, the radial head, and the ulna. And you can even go down to the styloid process. Do all you want to do the bony landmarks first, just to rule out any possible fractures. Then you want to check and feel muscles. Do the muscles, ligaments feel normal all the way up the arm? His fingernails look normal. And then you can start doing your special tests. You would begin with pulse, respirations per minute. Do their pupils look normal? You can do take their temperature, blood pressure, and pulse. Then you can do ask them to do active range of motion, what they can do on their own. Extension and flexion of the arm. And then you can do passive range of motion. You can move it for them. And then resistive range of motion. Can they resist you both ways? And then that would be also manual muscle testing. Do flexion, extension. Can they supinate and pronate? Can they do opposition? And then you would start on your special tests. Valgus test on the medial side of the arm for the medial collateral ligament. And then opposite is the valgus test, or the varus test, which tests for the lateral collateral ligament. Then you do opposition, which tests for fracture, and you can do Tinel's, which checks for any ulnar nerve damage, which would send radiating pain down the arm. And then you can do a Little League test, have them pull out of that, and tennis elbow, and have them break out of that. that's it.